primary healthcare is going through a lot right now. I understand what healthcare providers are dealing with right now. I really do. Whether you're primary care or a specialty doctor or anybody else that's on the team, nurses and physician assistants included, and anyone else that's on the team, from CNAs, RNAs, LPNs, phlebotomists. There's a lot of things that are disrupting the healthcare field. And it wouldn't be the case if it wasn't so infiltrated. It's a very infiltrated field. And what you see right now is a lot of changes with regards to how our practices, in particular primary care practices, is going to make ends meet. How are we going to make the costs efficient enough that the patient receives the care that they need and the doctors and all the other team members are compensated in a way that reflects, what the value that they provide for the community. I'm sure that there are some doctors that are, when they are studying medicine, are thinking to themselves, yeah, just put me on a team, a large team, and just let me go at it. I don't want to have to manage anything. Just put me on salary, call it a day, and I know my hours, and that's it. I'm sure. There's a model for everyone, right? But I am also sure, because I've had conversations with many of them, that they would love to be independent providers, but because of the cost, the insurance mostly, and paperwork and the overhead, they are unable to be independent. So you join a team, and that team, 3, 4, 5 doctors. In some cases, it may be bought out by a large investment group that just is in the business of buying hospitals and clinics. And it doesn't allow, those models are restrictive in the sense that there's always going to be someone else that's able to make decisions for you instead of the doctor. There are other models where, in order to extend care to more of the community without multiplying the amount of doctors, is by hiring physician assistants or expanding the nursing team. And that's great. Those providers are well trained. It's awesome. I'm all for it. But I think it's important for doctors to have options, and I've spoken about it before. I'm curious to learn more about direct primary care as a model because it divorces the insurance from the equation, and it's growing more and more appealing to me. But if a doctor is to pursue that plan, that model, it's important for them to have all the tools, all the team in place that will help them carry out what they want to, with the end goal being that of the health of the patient, the individual patient, and the community at large. Just because someone chooses to be a direct primary care provider does not remove the expense associated with trying to be independent. There are a lot of expenses. You can reduce your team and your employees by a lot, because you don't need a lot of people doing a lot of the paperwork that the insurance companies bestowed upon you. But there are still other things that need to get done. One of which being the marketing aspect. how do you buy over the public? How do you convince people that for the past 30, 40, 50 years have grown up in a model intergenerationally that has said that this is how you do it? The insurance companies run the show. Who are you to step out of line and actually, do house calls or answer your phone and just take an appointment just right over there, or practice telemedicine, which is another model I didn't speak about. It's a lot of work. You got to convince people. You have to have a marketing strategy. And I'm hoping that any direct primary care provider has given it some thought and asked themselves, where's my audience? Where are my patients? How do I get in touch with them? You have to take into factors, where do you live? What are the most popular, what's the patient pool that you're trying to target? It would be a safe bet to go after social media, Facebook in particular, especially if you're a geriatric primary care provider. I'm joking, but yeah, Facebook is valuable. You may consider Instagram. You may consider marketing on Pinterest. Figure it out. There's got to be a way where imagery or video on YouTube, or if you're into Twitter, which I'm not so much, but I understand why people use it. You have to have a strategy. Reach people where they are. You got to reach your local community. Are they frequenting certain locations that you could partner with, or engage in a conversation about putting out marketing material? Community forums. There's so much you can do. One of my favorites is podcasting, and I hope to speak at length about that in the future. But you have to have a plan. But what App Axis does here is make apps specifically designed for a practice, not limited to just direct primary care, but any independent professional, whether you're a dentist or chiropractor, even small business owner. But that marketing strategy, what the app allows you to do is control your sandbox. Facebook can change their algorithm overnight. Your SEO strategy for your website could change if Google decides, this is going to change. For instance, some people may put www.appaxisllc.com, and other people may say, oh, just reach me at appaxisllc.com. And while it's the same thing, it'll take you to the same location. Google would treat that as a duplicate website and penalize you. So your SEO strategy is compromised. But Facebook is no longer a secret. So their expense of advertising on there is getting pretty steep. There's a lot of restrictions on what you can do with your groups and your pages. There's a lot of things you got to be aware of when you start your marketing strategy. But social media, reaching out to people, calling people, speaking with patients directly, networking, got to have a boots on the ground strategy, an online strategy. But an app allows you to own that real estate, that digital real estate. Phones run on apps. Everything you do is run on an app. You go to an app before you go to your web browser on your phone. At least I do in 2018. I'm not sure how many of you go to your browser to type in YouTube or to type in, weather.com or whatever. But as for me, and from what the analytics and the statistics say, is that apps are here to stay for a while. And if you have your own app, you're not competing against the noise of the Twitter feed or the endless infinity scroll of Facebook, or, having another competitor advertise on your YouTube video. So, there's some things you can do with an app. You can still do all those things and have it all lead back to you through your app. You need to notify a group. You can do it through Facebook. Yeah, They may or may not get it, but through the app, push notification, it drops down on the phone. It says, hey, come get your free, diabetes exam or whatever, you want to notify the public. And App will let you do that. And it's noise free. You own it. You don't have to worry about a lot of the things that you would have to worry about if you relied solely on social media or the expense of printed content or discoverability issue that podcasts still have. Although podcasts are awesome, it's not as easy to discover them. But that may change given the voice-activated technologies that we have with Amazon and Google and Alexa and Home and all these things. But give it some thought. Feel free to browse the website, appaxisllc.com, maybe with the www in front of it. But yeah, let me know. What are your thoughts? What's your strategy? What are you doing right now to reach out to your patient population? What's the game plan? How's it working out? Are your patients, is your community satisfied with the way you're reaching out with them? Have you had any difficulties with Facebook or any other platform that you choose? Let me know. Comment, subscribe. Thanks for watching.